Auzubillahi minash shaitanir rajeem. Bismillahirrahmanirrahim. Assalamu alaikum and a very warm welcome to World This Morning. I'm your host Hajra Sati and joining me is my co-host Ali. Assalamu alaikum Ali, and how are you doing today?
Walaikum assalam Hajra. I'm very good this morning. How are you this morning?
Alhamdulillah, it has been raining for the past 2 days and I think the weather has certainly changed in Islamabad.
It has significantly changed and it has changed for good. I mean, it has become very pleasant. You must be remembering the last time we did the morning show, it was extremely humid weather.
That's very true, and I am really not very fond of the sudden changes in the weather because we used to enjoy a certain, I would say, spring, and we would enjoy the autumn season, and there was a span of that.
But
right
I believe,
now,
you know, resisting change is part of the human nature as well, isn't it?
Maybe, I mean, some people do not want to change, but obviously change is the only constant, as they say. But now let's move on to our top stories, which is about Prime Minister Anwarul Haq Kakar Saab is in the Beijing, obviously, to attend the third Belt and Road Forum marking the 10th anniversary of the China's massive infrastructure development initiative and its flagship project, the China-Pakistan Economic Corridor, known commonly as CPEC. The third forum will be attended by a galaxy of the world leaders, including Russian President Vladimir Putin and the leaders and representatives of nearly 130 countries. Obviously, it's a huge forum, and CPEC is one of the flagship projects of the Belt and Road Initiative, which is about connectivity, which is about the road infrastructure development, and which is making, obviously we are living in a very globalized world, but making it more global and more integrated and connected, and Pakistan is an important part of it, right Ali?
Definitely. I believe that this participation of the caretaker Prime Minister Anwarul Haq Kakar in the BRI is going to be a very significant milestone, as we are expecting very important MOUs to be signed, and he is going to meet with very important business conglomerates as well, which I definitely expect is going to be very lucrative for Pakistan and the whole region as well.
Right. So now let's kickstart our segment, and we want to talk about a topic which is very close to our heart, and being from a third world country, from a developing country, I'm really proud of the fact that Pakistani state has always catered to its poor citizens, especially in terms of the healthcare access. Right.
And here I must take this opportunity. I really want to talk about the caretaker setup, which is taking active steps for the people of Pakistan. I believe that in these few months we have changed, we have witnessed the tremendous change within the whole country. We have witnessed the economic uplift as well. And the situation of the people is improving. How do you think, Hajra?
That's very true. I totally agree 100%. But without any further ado, let's not monopolize our conversation and let's ask someone who represents the healthcare ministry, and he has so many feathers to his cap. He has been dealing with the healthcare sector in particular, and he also happens to be Tamgha Imtiaz, Sitara Imtiaz. He's the Federal Minister for National Health Services Regulation and Coordination, Dr. Nadeem Jan. He's gracing our studios, and we are very glad that he is here. Assalamu alaikum, sir, and thank you so much for coming to our show.
Walaikum salam, and thank you for the nice introduction and the energetic start that I had with you.
You truly deserve it, sir. So let's kickstart our conversation, since you went to WHO forum where you represented Pakistan, and when we talk about the healthcare sector, and I'm particularly very proud as a Pakistani because our state has been always catering to the people in terms of the healthcare sector and making the access towards the healthcare sector more affordable, right? So would you like to tell us what was the agenda of that meeting and how many points did you cover there?
Thank you very much. First of all, I would like to inform that access to healthcare services is a fundamental human right.
True.
And our state and our government are duly committed to provide those services at the doorstep of the population in an affordable, accessible and available manner, so that the whole spectrum of the society avail those healthcare services, and that's we are enduring to and we are aiming at. Now, regarding this conference, regional conference of WHO EMRO region that was held in Cairo, and I just returned from that was from 9th to 12th of October, where the member countries, they present their reform agenda, their interventions and their status of the health sector, how they are performing, what are their challenges and how they are going to address it. So, in the same tone, I had to present Pakistan there, and I presented our case. I presented what are the challenges that Pakistan health sector is facing and how we are encountering it. So, the reform agenda that we have initiated was presented, and it was duly endorsed and appreciated.
Right.
Yes.
Right. So talking about the challenges that are being faced by Pakistan, polio virus definitely it is a huge challenge for the country. And of course, like Hajra has said, that I myself I'm very proud of the caretaker setup that it is taking very active steps in the health reforms as well. So talking about the polio virus, what are the challenges that are being faced still by the caretaker setup? And what are the reforms that are required to be introduced for the eradication of this heinous virus?
Again, a very valid question, and there was actually a session on polio, and I presented my case there also, that what are the challenges that Pakistan is still facing and how we would address those challenges. So I provided a strategy which we have developed here in Pakistan to address the virus circulation, especially in the southern KP. Now, as you all know that this virus, wild polio virus circulation is confined to only southern KP. We receive cases from Banu, and from one UC of Banu, 3 cases, all the 3 children that suffered from polio virus were from Banu. The virus circulation in the environment is across the country, but 90% of those samples are associated with Afghanistan. So the main challenge that we are having operationally, this is a very strong program now. We are reaching each and every household. Our security agencies are providing due security to the teams, to the monitors and to the experts to freely conduct their activities. Now the challenge is the demand side, and there are 2 phenomena that we are going to defeat. One is some resistance from few pockets in Pakistan, especially in the southern KP, from the communities because of the misperceptions, the misconceptions and some misunderstandings and misgivings. The second phenomena that is indigenous to the program is that now, since polio has attained the highest priority and everybody knows of it.
Definitely.
So they use it as a bargaining chip, and when they ask for some demands like school and water and sanitation facilities or a hospital, so they influence the administration that if you did not provide those services to us, then we would boycott polio campaigns. So it's a kind of a boost to the program, but also it defeats the program as well. Like it shows that the program is so significantly flagged in the whole administration of Pakistan government, that it's the only issue that people think that the government is the most serious to. So they then use it as a bargaining chip, but we address those. The third phenomena is that there is a collusion between the teams and the communities. The communities, because they are not convinced of the significance of vaccination, and the worker who may have some motivation issue, they decide between themselves that we would allow you access to the child, you finger mark the child, but don't vaccinate it. And this is a killing phenomena because you cannot trace it. If the child is finger marked, it's assumed that he or she is vaccinated. But in some pockets this is happening. So these 3 phenomena now we are working. The Prime Minister in National Task Force meeting issued directives all over that these boycotts is the responsibility of the district administration to address those. The fake finger marking phenomena is the program issue, they should address it. And the resistance and this misconception is also the program internal issue, and now we are developing a revamped communication strategy that would be more appealing to the people, and we are engaging all spectrum of the society into that dialogue. So if there is any hidden misunderstanding or some misgivings, they are addressed thoroughly, and then the message is fully internalized. So the people's hearts and brains, they are one, and they are there with us, and we then eradicate this polio from Pakistan.
Right, sir. And one important thing which is very important and integral part of the entire polio eradication campaign is because a lot of people criticize that there is a fluidity of the movement between Afghanistan and Pakistan border in terms of the refugees, and that is why the polio is still unable to get eradicated because that movement is not very well documented, right? So how are we going to tackle that particular issue when we talk about polio eradication, right?
Yeah, it's of vital importance because as I mentioned that 90% of the samples in Pakistan in the environment are from Afghanistan. And you rightly pointed out there is cross-border movement, some informal as well. Though with the border fencing, at least 90% of that movement has been channelized and addressed and formalized, but still some happen, especially the medical tourism, because the facilities in Afghanistan are scarce and they are not of high quality. So most of the patients, they come here and to avail health services in Pakistan. So they bring the virus because the virus is more wild and more ferociously in circulation in Afghanistan. So, as you know, the virus can be carried even by adults.
Definitely.
It can paralyze the child under 5, but it can be carried by anyone. So, they bring the virus, and then this virus
Yes.
circulates in our society.
True.
But if the immunity of our children is not raised, then this virus may become indigenous and may cripple our children. So, that is why we are so serious about it. And as far as this movement is concerned, with Afghanistan, we were the first to take initiative, and I invited actually the Afghanistan Health Minister formally, that we should sit together, resolve these cross-border vaccination issues and also the importation of virus. Unfortunately, it hasn't yet happened, but we through WHO and through other partners, we are developing a coordination, at least a programmatic level coordination, so that this wild poliovirus importation from that end is addressed. We have at the broad border points, vaccination points, which inoculates, administer vaccine to all age.
Right.
Those who are going from Pakistan to Afghanistan are vaccinated. On the Afghanistan side, they only vaccinate children up to 15 years on the border, and we through development partners and other stakeholders, we want to influence them that they also should administer vaccine to all age, so that the carrier vehicle is stopped.
Yes.
Right.
And that doesn't happen in Pakistan.
Right. So, having a very truly accomplished career of 28 years and, working with the USAID, United Nations, EU, World Bank, Bill Gates Foundation, talking about the polio virus again, of course, the involvement of people and media, the civil society, I mean, is very important. So, what part the media and civil society can play in the eradication of this virus?
Very important again. We now have employed a whole of society approach and whole of governance approach towards polio eradication. So, that entails all spectra of the society, be it religious scholars, volunteers, teachers, practitioners, doctors, workers, they have been engaged. At the same tone, I would say that media, as its eyes and ears, and it mold public opinion,
Yes.
plays a
Definitely.
highly significant role in eradication of polio, but also in other health interventions. Because if we disseminate the right messages, people then internalize that message more easily than through a personal interaction or
Of
through
course,
any
sir.
other means. So, we direly need the advocacy, the lobbying and the efforts of all media, print media, electronic media and social media,
Yes.
all channels. By the way, we are utilizing that, but we need to refocus our strategy, and the revamp strategy would create more space for media friends, so that they play their role as well as a national of Pakistan and as a professional and as a human being as well.
Right. So, let's talk about one of the crippling disease which has gripped Pakistan, which is hepatitis, right? And your ministry is keen on initiating a program that will eliminate hepatitis by 2030. And obviously, one of the reasons that is quoted for the spread of hepatitis is the unsafe injections and unhygienic instruments that are used across the country, and there are lots of fake spiritual healers, quacks who are doing this, and we've seen that how they've injected the hepatitis into the entire villages, right? So, what is your strategy? How are you going to deal with that, especially such a massive scale?
Well, now Pakistan has decided that inshallah Prime Minister will launch the hepatitis elimination program very soon, and then we are aiming that we would be capable of eliminating that by 2030 inshallah, because we have developed a program that has taken stock of all the challenges that you mentioned, the infection prevention, the syringes and these unhealthy practices which are prevalent in the society, and then also medication for that. So, that is a thorough program, comprehensive in its nature, covering all aspects, and it will be announced formally, though it is already the groundwork has been completed for that. By the way, when I was in Cairo in Egypt,
Right.
Egypt is the first country in the world who has attained the gold tiers for the elimination, because they are 97% close to the elimination. So, they were rewarded
Okay.
with the golden tier as well.
That's
And
significant.
their ministry and their ministers, they are two ministers. So, both of them approached me proactively, as they are very keen and impressed with our new initiative, so they wanted
Right.
to talk about hepatitis elimination. They were very happy when I told them that Pakistan is on the path to announce the program for hepatitis elimination. So they offered their support because they are already well ahead of us. They installed measures that infection prevention in all the hospital, the healthcare facilities. Then the syringe use is religiously followed, and it is not happening there. The auto disposable syringes are being used, but it is watched and monitored, so malpractices and ill practices doesn't happen there. Then they offered me that if you need, we can send you a technical team also. That will be part of your ministry for some time, so that when you launch the program, the lessons that we learned that are implemented also in Pakistan. So you quickly receive the dividends of this program. It took them more than 10 years, but for us he was sure that yes, since we already have done this, then for you it will be easy to adopt. So we will be engaging them as well, and they were very keen. By the way, the health minister himself was very kind, and he said, even if you allow, we can send you right now the technical team that will be part of your ministry for some time, and then you can utilize them as needed. So the purpose was that we are very serious on this, and already we have moved ahead. We have engaged different international key experts on the hepatitis elimination and donors, the UN community as well. So they are on board, and now inshallah we will be launching it. And by the way, it was warmly welcomed when I announced that inshallah Pakistan will be announcing the hepatitis elimination program. It was warmly welcomed by the whole Imro region.
Wonderful.
Right, sir, and let's talk about a development that has gripped the entire Middle East, and by that extension the entire world, which is the war that has been initiated in the Palestine region. And obviously the way Israel is dealing with that, there is no access towards the medical aid, and Pakistan is also demanding the humanitarian corridor to be provided, especially, right? And since you are a health minister, and obviously they need a lot of healthcare access towards the people who are dying there. So what is the initiative of your government in this regard? And especially you talked about how in the WHO summit you specifically talked about it, and what was the response at that time?
Well, we have to re-imagine, not only re-imagine, but right-imagine Pakistan. And I think if we could right-imagine Pakistan, Pakistan is already there where it should have been.
Right.
So as far as this humanitarian responses are concerned, I go back to the Afghanistan when this the Taliban regime came in and the other regime toppled in Pakistan. Yes. In Afghanistan, Pakistan was the first country, despite all challenges, to launch a humanitarian response there, and that was globally appreciated.
That's
of
true.
course.
So the same when this happening, this cruelties happened in Gaza, Pakistan responded, and now we are ready. Already we have sent out commodities, medicines and blankets to Egypt, from where that will be channelized to through the humanitarian corridor to Gaza. But principally also, I spoke in the forum that health should be retained apolitical globally, all over. Health has got nothing to do with politics and
definitely
and with monopolies.
True.
Health should be treated apolitically. There should be a treaty that enshrines that health in every conflict, every tension, every political maneuvering, it remains apolitical. So health maybe through the government, acceptable government, or through international agencies, should be the first priority even in a war situation. And that's what I spoke about, that we should at least try that. For us as a WHO, as a health practitioner, as a health professional, patient is important, victim is important, and the oppressed is important.
Very true.
It would be not only in Gaza, but even I mentioned about Kashmir also, that in Kashmir, in Palestine, in Syria, everywhere where the patient requirement is needed, the health community should be addressing that everywhere, regardless of any creed, color, religion, faith, nationality.
Absolutely.
And so that's what we educated, and Pakistan is serious about addressing the health needs of the Palestinian who are suffering there.
Right.
And our
Right.
stance is very clear.
Right. So, of course, there is a lot of suffering and barbarities of Israel in Palestine. I mean, it's unimaginable. Even Hajra, when I read in the news, it is extremely difficult for myself as well to read in the news about the atrocities going on in Israel, in Palestine on behalf of Israel. So, are we planning on to send the paramedical staff from Pakistan as well? Because there is a serious blockade of the facilities and the doctors and the medical facilities, they are just simply at halt.
Well, Pakistan has already offered.
Right.
They have offered, and we have, by the way, standby arrangement of medicines we have, the emergency kits we have, the
Right.
paramedics and doctors. The same was when the earthquake happened in Afghanistan, in Herat. We were the first to volunteer that we are ready to be dispatched there and to utilize. So the same goes for Palestine as well.
Right.
And our foreign office is in touch with the authorities there and with the Egyptian government. And whenever the green signal is received, within 24 hours our mission will be deployed. And this is what Pakistan is famous about. We respond to every humanitarian catastrophe across the globe.
Right, of course, sir. And what a beautiful point you have raised, that, you know, this medical emergency and the patient and the victim, they must be always dealt apolitically. And it should be for everyone without, you know, any discrimination. So Pakistan is going to host its first ever Global Health Security Summit in November, and the summit is going to help Pakistan finalize its strategic roadmap to effectively tackle the health emergencies and epidemics as well. So how do you see this?
So this is a game changer that Pakistan will be leading for the first time in history. A Global Health Security Summit will be organized in Pakistan, and Pakistan has initiated this idea, by the way, to the whole world. And
Wonderful.
we have engaged the whole health community across the globe, the health ministries, the technical experts, the international organizations, the universities who cater for the needs of the students in medical and public health field. We received an overwhelming response, and now we are finalizing the dates. So the COP28 is also on first, second, third.
Yes.
So we will be thinking of how best we can address that date fixing issue. So the UAE government, Saudi government and Qatar government, who already had a plan to committed to participate, and even Pakistan had committed to participate in the COP28. So the date will be jointly and unanimously consulted with the partners and inside the government as well. But this initiative had received a warm reception from across the globe, because it's the first of its kind that all health ministries and global experts would be coming, and they will be joining a platform for special issues like the pandemic preparedness and response, vaccine equity, this patent deregulation, and also how best the resources can be allocated when a pandemic happens to the low and middle income countries, so that the low and middle income countries do not suffer disproportionately of the pandemics.
Right, sir. So since we belong to third world country, we are in the global south, and obviously our state do not have the resources to cater to the needs of all of the people like the developing or the developed world has. So how much do you think the importance of public-private partnership is important, especially when we deal with the healthcare sector? Do you think it's a viable platform here in Pakistan?
Exactly. It has been utilized, the public-private partnership, since long in Pakistan, but now we want to solidify that, consolidate that, and expand that.
Right.
Right.
So already, like in the blood transfusion services, we are aiming that this public-private partnership is enhanced, and the private sector is engaged. Similarly, in other programs and other interventions, we would like to utilize the private sector, especially the medicines. As you know, the medicine industry here is buoyant, and they are providing cater for the needs of the population, though on a small scale we import a lot, but for that also we have developed a plan that how best we can tap that resource of private sector. And in other areas of the health sector, in medical education, they are part of us, like you know the Aga Khan University, it's a private sector university, but government in various programs are in partnership with Aga Khan University. Similarly, the other Shifa International University and Medical College, than the other private sector medical institutions. They have been utilized appropriately, and in the same tone the hospitals, the pharmacies and the diagnostic facilities in the private sector are being tapped and utilized. And we can jointly venture even in the hepatitis elimination program.
Yes,
We will be venturing towards public-private partnership. By the way, in polio also and TB, we are utilizing private sector.
Wonderful.
We are getting data from their hospitals and clinics, and we integrate that data into our own systems.
Right. Thank you so much, sir, for coming here, for having
Thank
this
you.
wonderful cross-pollination of the ideas regarding the healthcare sector reforms. And once again, I would say that as a Pakistani, I'm really proud that despite the meager resources, our state has always catered to the needs of people, especially the marginalized ones in terms of the healthcare sector, and made sure that the accessibility and the affordability of the healthcare sector is always there.
True.
So with that, we will wrap up our segment, and we will once again thank our worthy guest for coming here, for telling us about the wonderful initiatives that government is making sure to do and cater to all of these citizens. And with that, we will go on a short break. So don't go anywhere, because when you come back, we have a very interesting discussion lined up. Good morning.
Good morning, Pakistan, and welcome back again. We are going to start with our second segment of World this morning. So, Hajra, now I believe that we are going to start with a very interesting discussion about the culture, the cultural economy,
Yes.
and how the culture can play a pivotal role in uplifting the economy of the people.
That's very true, and there's no denying the fact that Pakistan has a very diverse culture. So from
True.
north to south, you will find that there is diversity of ethnicity, there is diversity of languages, and obviously so the culture changes. And in order to celebrate that diversity, in order to celebrate that diversity of different languages, ethnicity and culture, we have a very wonderful guest in our studio who is going to talk about it and is going to explain what is the cultural economy means in the first place, and how Pakistan can get benefited from the cultural economy. We are very glad that we have been joined by Ms. Aisha Khan. She happens to be a development expert. Assalamu alaikum, madam, and thank you so much for coming to our show.
Walaikum assalam. Thank you for having me.
Right. So madam, why don't you explain to our audiences, and especially to layperson like us, what exactly is the cultural economy?
So the cultural economy, very simply, constitutes what it defines is people, individuals, businesses, and communities that transform our cultural skills, our knowledge and ideas,
Right.
or whatever constitutes culture. As you rightly pointed out, it's about our cuisine, it's also our architecture, it's our sports, it's our literature, it's our arts and crafts,
Right.
and just the entire range of how we do things. In fact, it even includes the natural environment,
Right.
Right.
because the natural environment influences our culture, how we do things, our dress code. You know, in different areas
true.
of the world,
True.
you wear different clothing. So all of that constitutes culture.
But
And the
I'm-
economy
right.
means transforming those
Into more
symbols
capitalism.
and factors
Yes.
into products and services.
Right, but I'm very intrigued by this point of view, is that, you know, the natural environment, it influences the economy as well and the culture as well. So can you elaborate a little bit more that how and what factors of the natural environment actually influence the culture and the economy as well?
Well, for example, in certain parts of the country, like in the mountain areas, the flowers you have, the flora you have, the fauna that you have, you know, the animals, for example, markhor or
yes.
snow leopard, and the food we have, the fruit that grows, that's all part of the natural environment.
True.
Even the soil in Punjab, the water, the soil, that's part of our natural environment. And that influences our agriculture. So,
Very
you know, our
nice.
production. So things within our natural environment Now, directly, how does it influence us? The fruit we eat. For example, there are apricots in the north or mangoes in the south of the country.
Yes.
We make a pickle from mangoes. The oil that we use, all of these contribute to the economy, to the local economy.
Right, right. So, Ms. Aisha, since you belong to the hospitality sector and you have a vast experience in particular sector, how much do you think the local community play a role when you talk about the cultural economy? So, for example, let's narrow it down to hospitality business or cuisines in particular, right? So, if you go to northern areas, their cuisine is different, and like you mentioned, and weather impacts that cuisine, right? So, cold weather requires a cuisine which is more acclimatized to your body temperatures and whatnot. So, and when we talk about the local communities, and especially when we talk about the tourism here in Pakistan, we've seen that the tourism is not very responsible in the first place. So, people go there, they are not very conscious of the fact that they might be degrading the environment there. How can we make a local communities more of a change agent there, so they can more have a ownership of that particular community, of that particular cultural economy, and they make sure that the environment is not damaged in the first place?
Okay, thank you for that question. Just a quick clarification. I belong to more than the hospitality sector,
wonderful.
being a development expert, so social and economic growth and climate change. So I work in sustainable development. I am on the board of Hashu Group, but I'm more, my work encompasses more than that. Going back to what you said about tourism and you know, the challenges that it presents to local communities, I think the biggest intervention in a way or something that we need to be mindful of, and there are groups and non-profit organizations that work on that, is awareness.
Right.
You know, creating that awareness, that sense of responsibility. I mean, a couple of generations ago, there used to be a class called civic responsibilities used to be taught, and I think again, it's over time, during increasing consumerism, we've become irresponsible by way of, you know, the littering we do, the kind of pollution that we create around us, and I think there needs to be awareness, maybe even fines for those who pollute. With regard to the community in local areas, they need to be trained on how to manage in terms, you know, tour guides or manage their community or their environment for training. So I'm just, you know, because there isn't enough time, so I'm just kind of giving the basics about awareness and training. I think that is something that needs to be emphasized, and where the government can play a role is maybe just you know, fines and just following through. So everyone is equally fined, and you know, both elite communities as well as the locals are, if they're being irresponsible, they should
be
equally be taken
because
to task.
I remember that Hajra, I visited Hunza, I believe a year ago. So one of the remarkable things that I witnessed over there was the cleanliness over there in the Karimabad city. So what the local people were doing, you mentioning about the policing regarding the littering. So they were imposing fines, like you are not allowed to throw a wrapper on the floor or on the road. So talking about the policing, what other measures do you think should be introduced in order to, you know, inculcate responsibility among the people, and how the local communities, they should be involved to harness a more, you know, a sustainable environment.
And one thing that is very important, especially when we talk about tourism and incorporating the local community element, is, Madam Aisha, that whenever you go and ask someone, you know, what is the way, so they're very important because they are living there and they know the entire area, right? So it's very important that we also invest in their training, so you know, how they can be more hospitable, how they can be more warm to the incoming tourists out there, right?
So so for tourism, you need infrastructure, and of course those are the roads and other things required. So you have eateries, then you should have those bins and disposable bins. Another opportunity in this waste is recycling the waste, you know, and turning it into, now we know that waste can be turned into profit, and you can make several things out of plastic and paper and cardboard. So I think little factories can be set up in the local vicinities to recycle waste.
Right. But
Now, a youngster from Hunza area, she told me, we don't need this tourism. People are so irresponsible, for want of a better, and insensitive, you know, so they're very upset.
Yes.
And although majority of the people going there are highly educated,
and they're actually harming the environment.
And the way
over
that
there.
they litter is absolutely shocking. I mean, I've traveled on Babu Sar Pass and the kind of litter. But I must say, I mean, it is improving. There are youth groups that, you know, are creating awareness.
This is true.
And I think that the local government should facilitate rather than, it shouldn't just be by way of penalties, but also
incentivizing
reward, positive, you know, support that is given. So maybe holding contests for those who don't litter, or kind of volunteer to clean up an area. So, and you know, kind of giving them that recognition and promotion. So we're talking about behavioral change. And for behavioral change, you have to have penalties as well as reward. So it's a bit of a carrot and stick approach.
Right.
Because if it's just a stick approach, it won't work.
It won't work.
And if it's just, you know, carrot, just a reward, that won't work either.
There needs to be a balance.
A balance.
So, mashallah, madam, you have such a diverse experience in the hospitality sector as well. And mashallah, you were speaking so eloquently. So, over the period of time, what are the behavioral changes that you have witnessed in the people?
Yes.
Has it become better or has it gone worse?
So, I think as I see the younger generation, it's become better.
Right.
They invest their time, there are more volunteers, they're more mindful. You know, several startups have been, and I myself as a IFC World Bank certified and trained enterprise development trainer and teacher. So I've trained youngsters, I've on the board of incubation centers. So what I've helped establish startups, and there are many startups. I think there's one in Islamabad called Saaf Suthra Sheher.
Wonderful.
Right.
And there are many others, I forget the names, you know, from Islamabad to the whole of Pakistan. In Karachi, technology is leveraged to, you know, clean drains and come up. So quite a bit is happening, you know, so that I see a positive change. Having said that, I think maybe local governments or the kind of policy environment needs to be a bit more supportive. And of course, everything, we are talking about the economy because we are within a political and economic environment.
That's true.
And for any kind of development and growth, you need a bit of stability.
True.
So that is something that recently we're faced with. These are some of the...
Right. And madam, what are some of the challenges which you envision can be in the way of developing a more vibrant cultural economy in Pakistan in particular?
So first of all, going back to the concept of cultural economy, very few people understand what it's about.
Right.
I mean, I want you to, if you imagine the Scandinavian countries, IKEA, right? That's part of their cultural heritage.
Yes.
The wood or the pine wood,
Yes.
and then they developed it into a product that they can sell, or various others. So we generally just think about handicrafts or embroidery or what have you. That it's much more than that. And like I said, it's the entire range of products and services that will help strengthen the local economy. People can add, they can bring in their knowledge, their expertise, you know, even making pickles and jams and jars, everyone makes it differently, making cookies. Also in Balochistan, there's a game called Hashti, I think, if I'm not mistaken, Hashti.
Okay, wonderful.
Okay.
And we don't know about it. Majority of us in Pakistan, it's a beautiful game. And that is something that I'd like to promote. So I've established my own non-profit called the Sustainable Cultural Economy Organization.
Definitely, promoting the local cultural norms is very important.
And so what it does is it also helps facilitate social harmony and peace.
All right.
So when we are comfortable with our own identities, we are proud of our, as Pakistanis, of our cultural heritage.
Yes.
That enables us to, be more tolerant of others around us, and to realize that yes, we have our uniqueness, but we all go through the cycle of birth and getting married and becoming more mature and being happy and sad and celebrating weddings and whatnot. And it's in a different way, and we should be happy about it, as you
Well,
said.
definitely, Pakistan is indeed a beautiful land having beautiful cultures. I mean, as you have said, Hajra, that, beauty lies in the diversity of the cultures that are present in Pakistan. So, Madam Aisha, thank you so much for your time, for your participation in the world this morning. And it was wonderful to have you to speak about not just the culture, but how culture can, uplift the economy and the sustainability of the people as well.
Thank you so much for coming here. And with that, we will wrap up our segment and we will say Allah Hafiz. So until next time, it's a goodbye and good morning.
Pakistan.